Okay, I think we'll get started right on time. Hello, everyone. My name's Emily Perello. I'm Head of Programs at Beyond Essential Systems, and I'm hosting today's webinar, which is a really fantastic one, bit of a different one for us, focusing on the use of digital tools for healthcare worker education and capacity strengthening. Thanks also to DFAT under the Partnerships for a Healthy Region initiative. So as people trickle in, I will just give a bit of a plug for our next webinar, which is also a really exciting one, looking at the next massive release of Te Manu, which has a lot of very big features coming through. So clinician dashboards, notifications, medications, and more. So that will be a really fantastic one on the 10th of July. Just confirming everyone can hear me. Maybe Louisa, can you give me a thumbs up? Yep, perfect. Thank you. Okay, so today's session, we've got a really great selection of speakers today. Cara Chessel, and also Rebecca Ilave from Catalpa, talking through their healthcare worker training program in PNG. We also have Louisa Wong from the M Supply Foundation and Geraldine Sowie from World Vision PNG talking rate selection. For questions, if you have them, please pop them in the chat as we go, and we and the speakers can answer those throughout the session. Or if we have time, we can also put some of the questions to the speakers at the end, but please feel free to pop in your questions as we go. Okay, so let's hand over to our first speakers. So we have Cara Chessel, who's the Head of Education and Gender at Catalpa International, where she leads the design and implementation of inclusive evidence-informed education and training initiatives across the Pacific. With over 15 years of experience, Cara has worked on locally led, digitally enabled solutions for workforce development, including the program that she's going to be speaking about today. Her expertise spans education system reform, education economics, and applied research, with a strong emphasis on co-design and sustainable impact in complex development contexts. So it's a real pleasure to have Cara with us today. And we also have Rebecca Elave, who's an experienced program manager with a background in environmental advisory and has worked for both local and international organisations such as The Voice Inc. in Papua New Guinea and the World Bank Group. She also co-founded her own edtech startup where she designed computer coding classes for local girls. At Catalpa, she was the e-learning specialist for Kamul Health School and is currently a digital manager in Papua New Guinea. So I will hand over to Cara, who I believe is going to kick us off today.
Thanks so much, Emily. And I'll just begin by acknowledging the Jagera and the Turrbal people as the traditional custodians of Meanjin and Brisbane, the lands that I'm presenting from today, and just pay my respects to elders past, present, and emerging. As Emily mentioned, I'm Cara. I'm presenting today with my colleague. I'll let her jump in in a moment. But yeah, just thank you so much for the opportunity and hope to have lots of questions. So please put your thinking caps on. If you can jump to the next slide. We'll talk a little bit about our organization, the challenge that we've seen in the healthcare space for training, but also beyond, a little bit about our model and the rationale for this new approach. I'll hand it over to Rebecca at that stage to talk a little bit about the app that we've built as well as the Kamul Health School program. Next slide. So Catalpa, we started in Timor-Leste in 2008, which seems like ages and ages ago now. And we've implemented more than 25 programs across the Indo-Pacific. We really focus on using technology across all of our projects, and we do projects in education, health, governance, and beyond. But our three programs that we've done related to this topic today have been Haromon, which looked at training for healthcare professionals in Timor, We also did Como Health School, which we'll focus on. And finally, we're currently developing a training for healthcare workers in Timor focused on NCDs. So lots of overlap and I think interesting points to bring together. Next slide, please. So the challenge that we've seen is really that essential workers receive infrequent or poorly timed training. And this is true in many different sectors. We worked with midwives in Timor, and we realized when we were working with them that oftentimes they would be asked to leave a health post to do training. And when they did, the health post was actually unintended. So anyone who needed their services weren't able to get it. And it was often really expensive to bring them from their health post to a central training facility. Really similar with science teachers that we've worked with across the Pacific. They weren't really getting training that was fit for purpose. So they were getting training that was on windmills or other concepts that just weren't relevant for the context that they were teaching in. And similar with agricultural researchers, they really needed to be in the field, and it didn't really lead to having a lot of time. So they were out sort of doing their research and they couldn't really find time to do training. And so when they did, it was maybe every few years, and it wasn't really aligned to the knowledge that they needed at that time. If you go to the next slide, please. So what did we do? We entered into this co-design process, and this was probably about 7 years ago now. And we've now co-designed the tool in the Pacific. We made sure that our approach really fit the context, and that meant testing and iterating it for low bandwidth and low digital literacy context. So we know that a lot of the times people know where to find the internet, but they may only have intermittent access. And also, this might be the first time that they're using a smartphone for the purpose of learning. Next slide, please. So what did that look like when we did the co-design? We came up with this idea of microlearning. It was kind of new 7 years ago. Now it seems like it's everywhere. But the idea is, what can a learner do that's really meaningful in under 20 minutes? And how can we make sure that what they're learning is culturally appropriate and responsive to the context that they're living in? This is a quick little demo on the right. We'll give you a proper demo later of what the Como Health School program looks like. But the idea is, can you center the learning on the mobile device? And what does it mean for pedagogy or teaching practice when you transform from a face-to-face or fully online to something that looks more like this? Next slide, please. So part of that challenge was making sure that we had flexible language options. This was really important, especially in Timor, where we know that a lot of the preferred language of learning is local languages. A little bit more challenging in the PNG context where you have 800 languages, but we knew that it was important for whatever tool we used to be able to have those flexible language options. Again, it had to work offline and with low digital literacy. And we also knew that most people who were going to be engaging in online learning, they were going to be doing that through a smartphone because that was a primary device that they had access to. Next slide, please. So what did we come up with for our model? And we call it blended learning. There's lots of different names for these things, but we think blended learning fits kind of what we've been doing. If you go to the next slide. And for us, blended learning is really simply doing some learning online and some learning face-to-face. Next slide. And part of that model is when you can learn more frequently than in person, it allows you to learn skills when you need them. So maybe you have something coming up where there's a new policy that's out there and you need to be able to implement that new policy. So when that policy comes out, having training relating to it means that it will be easier for people to remember and use that knowledge when it's actually happening in that context of when they need to access the new knowledge. Next slide. So online learning is great, but we all know that it can get a little bit boring. It can hard to be motivated by yourself. Many of you have probably signed up for Duolingo or LinkedIn Learning or something, and you're like, oh, this is great. And you're really motivated at first, but over time, you sort of lose that motivation. So we realize that it's really important to pair sort of that online learning with mentoring and coaching. Typically, we've done that through check-in phone calls. Knowing that people have that sort of support means that they're able to persist a little bit better through the learning process. Next one. Communities of practice. So it's great to have a coach and mentor, but it's also really awesome to learn from your peers. So we've been using virtual meeting software, oftentimes Zoom, to run these sort of sessions that bring people together, whether it's teachers or agricultural researchers or healthcare workers. It helps them sort of feel less professionally isolated. If they're out in a health post that's quite far away, there might not be other people with similar skills. And so, how can we combat that sort of professional isolation? How can we make space for them to share best practice? And how can we also help them sort of work together to problem solve? Because we know sometimes what we learn from a book isn't what's really happening on the ground. And so, how can we use each other to problem solve and engage in sort of this idea of sense making to improve how we're offering our service delivery? Next slide. And finally, we want to know what people have learned. This is really helpful for them, but it's also really helpful for us as educators. We want to know, is there some verifiable evidence, is kind of the technical word, of what people learned. And so we want to know that they've been able to actually apply this practically, and that they've reached their learning outcomes. So that's all part of our model, sort of the online training, the communities of practice, the mentoring, and finally the assessment that kind of brings it all together to make our learning model. Next slide. And then just really briefly on the rationale, like why do we need to change from running face-to-face workshops? Next one. It's actually quite simple, cost-effective, and scalable. We know that it's easy to use. It's a lot cheaper than trying to train and print and bring everyone together. And that's especially true for remote communities. And by having all of this online, people can access it. And it really is a sort of an equity issue. So making sure people, no matter where they are, can access high quality training. Next slide. And it also offers more regular long-term training. So when we're able to deliver it over the phone, it's not a one-off workshop. It's something that we can actually come back to and build into people's daily practice. I think last one, maybe. And then we know that people like to be recognized. So we know that it's important for the learning that's happening to count up towards something bigger. So we have these micro courses and the evidence, and that allows people to earn certificates or badges or whatever is appropriate to the context. Next slide. Just really briefly, the product has a few capabilities. Next slide. That includes some courses, some social learning, offline functionality, and assessment. Next slide. And I'll hand it over to Rebecca. I know I went a little bit long, but hopefully she's got enough time to talk specifically about the program in PNG. Thanks.
All right, thanks, Cara. You're absolutely fine. Hi, everyone. My name is Rebecca. I'm a digital manager based in Port Moresby. So Cornwall Health School is really more than just digital learning for health workers. It was contextual job-embedded professional development for health workers in PNG. Next slide. So Cornwall Health School is a blended learning program. As an educational program, it combined in-person or virtual sessions held by subject matter experts with health workers. And that face-to-face element was complemented by self-paced learning on the digital platform. So the digital platform, as Cara mentioned, is powered by Bero, which is the mobile learning platform created by Catalpa. So Cornwall Health School was co-designed using principles of human-centered design with users of the platform. And for us, this meant holding virtual sessions with users and subject matter experts to design the content that optimized the user experience and achieved their educational outcomes, delivered in a manner that suited their jobs and their ICT and cultural context. So it meant that this learning was job embedded, it was flexible, it was mobile first, and it worked in low bandwidth environments. So by applying human-centered design principles, it enabled us to overcome a lot of the contextual challenges experienced when implementing a digital education program in the Pacific Islands. Next slide, please. So to give some background of the program, for those who are working in PNG, Cornwall Health School was a small part of the Angao Memorial Hospital redevelopment project underneath the clinical support program. So the redevelopment project was this massive construction project that built several new facilities of the second largest hospital in PNG, which services 3 provinces with inpatient and specialist medical care. So Kumho Health School was a pilot that started in 2020, and it was developed in response to the COVID pandemic. So what happened was the subject matter experts who were supposed to travel in person to upskill health workers and train the hospital workers on the new hospital facilities and equipment. They were unable to get to PNG because of COVID travel restrictions. So a digital platform was developed together with those virtual training sessions to support the upskilling of clinicians. Next slide, please. So who is the audience for Kumho Health School? Within the health sector of PNG, there are several cadres of health worker, and Kumho Health School was designed for them, which included clinicians as well as support and admin staff. Next, please. So for the program itself, the Kumho Health School digital platform delivers 27 courses and 106 lessons that can be taken on mobile phones by any healthcare worker at Angao Hospital or Port Moresby General Hospital. So the content itself has 4 major modules: infection prevention and control, leadership in maternal health, emergency medicine, and operating theaters. The mobile learning was led by in-person or virtual sessions with overseas SMEs calling into the in-person sessions in PNG. And you can see such a session taking place in the photo on the right there on the screen. And the photo on the left shows that there was also in-person training of health workers in newly installed equipment at Angao Memorial that was relevant to the module subject areas. Next, please. So an important feature of Kumho Health School, or KHS for short. Sorry, I might say KHS from time to time. I'm just so used to the acronym. So the important feature of KHS was the visual design. So neuroscience shows that people learn better when they see educational content delivered to them by people who look like them. So across the various roles represented within the Papua New Guinean healthcare system, we worked with graphic artists to create a suite of characters who look like PNG health workers, wearing their uniforms. And we had voiceovers in multimedia and audio on the digital platform that recorded local clinicians and program managers. So they essentially did their own voiceovers. And anecdotal evidence, so the stories we're hearing from different people showed that this was one of the most compelling features of KHS by learners on the platform. They really like this feature, and it reinforces what we already know, that representation matters. Next, please. So we're proud to report that in an independent evaluation that was published in 2023 in the Lancet Western Pacific, I can see my colleague, I think Andrew Erbs is on the line. Andrew Erbs is part of this report. It was published by the Australian Kumho Health School as a blended learning approach for upskilling in emergency medicine, and the findings validated our approach. So it was found that the post-training exam showed a 12% increase in knowledge compared with the pre-training exam, with 100% of respondents agreeing or strongly agreeing that the online platform was easy to access, it was intuitive, and that the digital learning methods were appropriate for their learning needs. Next, please. All right, so we're grateful for the research, but we also wanted to tell you a more human story of impact. So we'd like to introduce Sister Daisy Langu. So she has been working at Angao Hospital as an emergency medicine nursing officer for a number of years. I'll give you a few moments if you like, if you've got your phone, to capture the QR code that's on the screen. It'll take you directly to our blog post that's published on our website, and you can read more of her story there. So yeah, if you got your phone, just bring it out, open up your, if you know how to read QR codes, please do that, go ahead. But otherwise, you can search for the Sister Daisy story on our website and you can read it there as well. Next, please. Okay, it says demo here, but I'm supposed to go to the next slide. Sorry, there was a mix up. Could you go to the next? Thanks, Emily. All right, so Sister Daisy is a nursing officer who, although she belongs with the emergency medicine unit, she took it upon herself to take all 106 lessons on Kumho Health School within her own time. So the flexibility of the online, offline learning model meant that she could sit in places like this outdoor area commonly used by nurses on their rare breaks, that you can see in the photo on the right. And she could download content and go through these bite-sized chunks of learning before returning to work. So one thing that the independent evaluation reinforced with us was that there were statistically significant improvements in confidence for 13 of the 15 clinical tasks among learners of the platform. And this is supported by stories of nurses like Sister Daisy. So we learned that due to learning on Kumu Health School, emergency medicine nurses of their own volition, they got together and discussed how they could improve their triage practices. And they then implemented those practices through their nursing unit there at Angao and found that they cleared their waiting rooms at a faster rate as a result. So this is just one of those positive stories that we hear of how this educational learning content actually gets transferred into work practice within health facilities. And that's it. I think we can jump to the demo now. So sorry, Kara, could you share your screen, please? So I've talked a lot about Kumu Health School, but maybe it's time for you to actually have a look at how it looks like. So Kara will be driving for me, and I'll just talk through Kumu Health School. But this is an example of how Kumu Health School would look like on a mobile phone. We mentioned that Bero, which powers the Kumu Health School platform, is mobile first. And that's why the screen you can see is very narrow. It's because it's specifically designed to work on a narrow screen. And this means that, you don't have really large blocks of text, or it's difficult to navigate. It's more intuitive and it's more simple. So sorry, if you could scroll back up, Kara. So if I'm here on my phone, this would be the first thing I see when I log on. And the very first thing you'll see up at the top is that it prompts you to go back to your most recent lesson that you've been taking. If you scroll down, Kara, or if you want, in exploring the platform, you can see more options for all the courses that are available for you to take. If you can scroll down a bit more, Kara. So also on the home page of the platform, you get prompts for trending discussions. So if there's discussions that have been particularly active and lively, you get notifications here. And this brings it back into those communities of practice, getting together with other people who are using the platform to reinforce that social learning for yourself. And then if you keep going down a bit more, there's the oh yeah, sorry, that's the end. That's the course categories for the different subject matter areas on the platform. Yeah, maybe we could jump to the next button at the bottom. So it's a very simple interface. There's only 4 big buttons at the bottom that take you to different areas of the platform. This particular one takes you to the different modules. So I mentioned emergency medicine, infection prevention and control. If we click on the ED course 3, triage, this takes you to the lessons within this course. So as you can see, when you first get on, you have a little introduction to what this course is all about. And then it shows you the different lessons that are available on this. As you can see, Kara, if you scroll down a bit more, oops, sorry. I just wanted to show this real quick. Right at the bottom, it says course exam there. So Kara has been a very good student and has taken all of her lessons on this one. But when you first logged on, and if you try to take this lesson, you would see that this course exam would be locked. So it would actually be grayed out and you wouldn't be able to take it until you're finished taking all the lessons. So this is an example of how through the platform, you can make sure you bring your health workers or other essential workers through a learning process where they know that at the end they can get assessed for what they're learning. Yes, so Kara has clicked on a lesson. So this is lesson 2 in triage assessment. And this is really the interface, the learning interface that this really gets into the meat of the lessons. So at the beginning of every lesson, there's a learning objective. So it sets out those outcomes that we want to learn through this lesson. And then it starts taking you through. So as you can see, very simple interface. You can see a lot of the graphics that have been created specifically for this platform. Kara, please keep clicking through. And so they explain different concepts with these simple graphics to really communicate what these are about. And as I mentioned as well, the platform also supports multimedia embedded in it. So you can't hear the audio coming through, I don't think, but that's okay. Basically, the audio that you would hear at this point would be these voiceovers from clinicians at Angao Hospital. They had a lot of fun with this, I believe, in creating these videos together with our learning designers. Next, please. Oh, sorry, I mean like next. Yeah. So throughout the lessons, you can also have the ability to have quizzes. So if you click on an incorrect answer, which I believe is anyone other than that one, Kara. Kara's too good at this course. She's taken it too many times. But these quizzes really help to reinforce learnings that happen earlier in the course and throughout. So you can put in a quiz anytime you like, and you would have these clinicians reinforcing their learning as they go through. And then finally at the end, oh, that's okay. So if you're incorrect, you can also have the ability to explain why to your learners on the platform, which is good. Again, this is how people learn. Correct. All right, so right at the end, we have this prompt for people to talk with their team. So this helps them, again, to go back to that social learning and talk with other people within their unit who are also undertaking these courses. And then right at the end, there's a prompt to go and take the exam, or to go back to the course, or to join the discussion boards, again, reinforcing that social learning. And then this was important too. You also had the ability throughout the platform to, after every lesson was completed, for users, for learners to be able to give feedback on the lesson. And this was really vital to us because it gave us a lot of practical, iterative advice on how we could improve the platform and the content. So it's a great way to get real-time feedback from your users to make sure that your content is actually addressing their needs and what they need to be learning. And yeah, that's basically the lesson itself. I'll also mention really briefly as well, there's other buttons as well for resources, so people could also access PDFs and other videos that could be also accessed offline. So all of the content in this, including the lessons and these resources, can be downloaded and served directly to the user from their phone, which is a really handy feature. You don't need to have 100% internet access in order to be able to access these courses. And this even applies for quizzes. So people would complete the quizzes, it'd be stored in the app on the phone, and whenever you would go back within internet Wi-Fi distance, then it would then it would resync, and all of your progress on quizzes or exams would be captured on the platform so that you could work towards your certificate. I'm sorry, I've spoken a lot, but that is it, I believe. So yeah, I'll just pass back to Kara. Thanks so much for your time, folks.
And maybe we can come back to these at the end, but we've done a few of these different projects now, and so we're trying to think about how we bring them important things. And I think when we're converting face-to-face learning materials into mobile-first microlearning, sometimes we think it's going to be really simple, but you actually need someone with learning design expertise. You need that subject matter expert, but also localization matters. We're finding that AI can help, but you still need a human in the loop when you're converting those materials and making sure that they're actually aligned to the pedagogy, which is that mobile-first pedagogy. We also know partnership with government is essential, but institutionalization is really hard. So you have to think about it during the training process, helping them to maintain it and helping them to scale it, and figuring out where that sits in the institution can be quite challenging, but really important to do from the outset. Finally, digital models of training enable you to be responsive to learning content development that meets the emerging needs of the system. So in Kumul Health School, that was COVID. But now in Timor, we're able to address a growing crisis, which is around NCDs. But it also means that as future pandemics or future events come up, that you can continue to be responsive to what's happening and create materials that enable that sort of lifelong and workforce development goals. So thanks so much. We took a little bit longer than we anticipated, but I appreciate we can take some questions maybe at the end. But back to you, Emily. Thanks.
Great. Thank you so much, Rebecca and Kara. That was fantastic. Yeah, it's really a very interesting program that you developed, and I appreciate the co-design and the work that went into the visual and vocal representation of the health workers in that app. Really fascinating. We will continue on, but before we do, just a reminder, please, yes, please add questions into the chat. It will be great to keep the conversation going in the background. So I'm going to hand over now to Louisa Wong, who's a project manager and pharmacist at the MSupply Foundation and currently working on the new MSupply Foundation e-learning platform content. And she's going to be presenting with Geraldine Soe, who is the MSupply coordinator with World Vision Papua New Guinea. So over to you, Louisa.
Thanks, Emily. Oh, next slide. Oh, we'll skip the slide. Okay, hello everyone. Okay, we can skip that slide too. So just to give you a bit of, go back one slide, sorry, Emily. Yeah, okay. So just to give you a bit of background about myself then, my name is Louisa and I'm a project manager for the MSupply Foundation, who I've been with for the past 2 years. And right now I've been leading the MSupply Foundation e-learning platform and helping with developing all of the new contents on there. And I'll let Geraldine introduce herself too. Geraldine?
Hi everyone. I'm Geraldine Soe. I am a pharmacist by profession, but I've been working as the M Supply coordinator for the past 2 years. Thank you for the opportunity to be part of this webinar. Over to you, Luisa.
Next slide, please, Emily. Okay, so just to give a bit of background about MSupply for anyone who doesn't know, MSupply and OpenMSupply is the logistics software that we use to help countries manage their medicines, vaccines, and other health supplies. It's used at all different types of levels, from the national warehouse down to remote health posts. And so basically, how the e-learning content started for MSupply was that we'd found that as we started supporting more and more countries, we ran into some challenges over multiple times where training was mostly in person, which was hard to scale, and it took a lot of time and our resources. And material wasn't always consistent, and with a lot of high staff turnover, a lot of knowledge wasn't actually being passed down properly. And so, especially in remote areas as well, we had internet limitations, which made things even harder to access for those who wanted to do remote training. And we also found ourselves doing the same onboarding repeatedly. So all of this meant that people were learning how to use MSupply in different ways, and then some people were struggling to keep up with the Ministry of Health teams, almost stretched thin, trying to support everyone as well. So we knew we needed a better way to train everyone, something that was more flexible, easier to access, and could be scaled with demand. And so then that's where we started coming up with the MSupply learning platforms. Next slide, please, Emily. So what we needed was something that was easy to use. That meant that it needed to be mobile or tablet friendly, and then something that you didn't need any tech skills to be able to follow through. Offline and low bandwidth to help with all our remote users, and allowing the courses to be downloaded so that they could use later when they wanted to. We wanted something that was scalable for learning so that a lot of people could access these training material, have the same content learned, and be consistent in how it's delivered. And then we needed something that was trackable and credible as well. So we wanted to make sure that after they've finished learning something, they did get a certificate for it to show that they are accredited in a specific area so that they can help apply that knowledge and help others as well. Next slide, please. So the solution, we started off with our Talent LMS courses for Legacy M Supply. And so I'll show you a bit about that in the next slide. And then we've now moved over to Moodle for our newer OpenM Supply phase. And slowly more and more courses will be introduced on that platform too. But I'll go through that in a bit as well. Next slide. So for Talent LMS, it's been going on for, I think, about 4 or 5 years now. And with that, there's been over 1,100 learners that's come and participated in the courses. 963 courses have been completed. And from Talent LMS, with the reporting, it tells us what benefits the courses have had from this. And so from that, there's approximately $400,000 in savings from training. And that includes things like being able to hire a meeting room or travel to a place to host these trainings. So because they're all done remotely now, it means a lot of that saving is accounted for. And then there's about 4,000 hours saved in travel from doing trainings in person just by having it online. And then on the side here, we can see that overall, there's been over nearly a year and a half of training time that people have actually spent on the courses in total now. And we've got the hours shown with all the different courses that we have with our MSupply desktop user level 1 course nearly reaching 5,000 hours. And so it's been really good on Talent LMS. Next slide, please. And then we have had our reward system with it as well. So all our users love participating and trying to earn their points to be at the top of the leaderboard. So we're migrating Talent LMS over to Moodle now, but I just wanted to give a shout out to our top 3 users over here. I've got Isaac, Desmond, and Sam. I'm not sure if they're in this webinar, but if they ever watched the video back, they can see that they have been recognized for all of their hard work in the courses. Next slide, please. So with Talent LMS, there were some limitations. So most of it being that it wasn't really open source and we needed something that was more accessible and easier to use for learners. And so more recently, we're starting to move over to Moodle with our MSupply learning content. And so what this means is that it's open source, used globally around the world. And we also have some fresh new courses available already on our platform and some more coming soon. With the Moodle app, users can actually download the Moodle app and then download the courses that we do have available and look through these offline as well, do the quizzes offline and still get their certificates all offline. And you can see over here, it's able to be opened on phone and on tablets. I've got a picture there of it. It's flexible to customize for different countries and programs. So generally, if countries did want specific content as well, they can always reach out to us and we can see what we can do to try and make content a bit more specific to them for them to access as well if they needed. And then it also allows web browser extensions to translate the courses. So for example, in the top right corner, I've got the Google extension on and I've translated that one with the Google extension to Samoan. So in terms of accuracy, I can't guarantee it'll be fully accurate, but at least it'll help our users understand a bit more context rather than reading it in English. And so that course right there is our Introduction to Medical Supply Chain course that you can see in the screenshot. Next slide, please. So the other part of Moodle is with our new courses, we can still add all the different types of content material that we have, like videos and pictures and even click-throughs. So this is an example at the bottom here. If you want to try out our OpenM Supply as like a click-through demo, you can access our Introduction to Medical Supply Chain course. And this click-through is actually one of the very last things you'll see on the course. So once you get to the end, you'll be able to have a play around on that and see what OpenM Supply is like too. Then we have our legacy courses, which have also moved over. So any of the content that was on Talent LMS that anyone's been doing. You won't be missing any of those because it will still be available for access on our new platform. We want to also, with our new platform, focus on real-world scenario-based learning, peer insights, and having everyone be able to collaborate, share their experiences and the activities. So I've seen some come through already from people who have participated where they're telling us what their roles are and what their struggles are. And so everyone's sharing all their ideas and thoughts about that. So that's really cool to see. And then we also have our progress tracking and instant feedback to guide users on the way as well, how they're doing and anything that they need to work on. Next slide, please. So finally, that's our new learning platform website there that you can access. There's also a QR code on this one as well that you can grab your phones out and scan through, and that'll take you to the page. Then once you're on the page, you just register. And unfortunately, I think right now a lot of the emails are being sent to the spam folder. So if you can't find the confirmation email for registering, just jump into your spam folder and you'll be able to see it on there. And so once you're on, you're going to be able to start on the new courses and get certified. And you can also check out the old courses as well. And most importantly, if you could share us your thoughts and feedback for the courses as you do them. If there's anything that you're struggling with, feel free to send us an email. It's at the top over there. And you can let us know if there's any problems or anything like that. We're always happy to help. And so now I'm going to pass the floor over to Geraldine. And she will share us some insights about how users have been finding the content.
Thank you, Lisa. Next slide, please. All right. So before I proceed to share my personal experience, I just want to highlight. You know, but publicly there's 9 million people, over 9 million people, and there's over 800 languages that are spoken in the country. And the geography is mostly mountainous with coastal lowlands. So you will find that more of the population reside in the rural area than in the urban area. All right, next, please. So since the implementation of mSupply, there's been over 500 sites that are implemented with mSupply currently in the country, with over 1,000 users that were trained. So next, please. I began my actively engaging as an mSupply trainer in 2023. Initially, I faced challenges in clearly explaining certain concepts and definitions within the mSupply system to my trainees. So this has led me to explore the mSupply e-learning platform, specifically the Talent ELMS. So the course materials and the platform's user-friendly interface made a significant impact, a difference in my understanding. Now, this has not only enhanced my own knowledge, but also boosted my confidence in delivering training. This in turn positively impacted the learning experience of my trainees. So, next slide, please. Sorry. Next slide. All right. Okay, so, but then there's certain challenges in fully utilizing or fully sharing the e-learning platform to other users of mSupply in the country. Now, before I move on or proceeding to sharing that, I would like to highlight the uses of the e-learning platform. Next slide, please. So previously we had the Talent LMS, and then we moved. Just recently we moved on to using the model. Next slide, please. So with the new e-learning platform, the model, We had a training that happened late last year, the MDM training that was conducted in a classroom setting to introduce the e-learning, um, the platform, the model one. Right. So next, please. All right. But before that, we had the talent LMS, where one of our super users, who is Matthew. He was actually one of the top users of the um, the accreditation course back in 2022. I think he came third. So based on his experience and his use of the e-learning platform, he mentioned that, or he shared with us that the e-learning course gave him an in-depth knowledge of RAM supply, far beyond the brief in-person sessions that we had with him. So this made his daily task clearer and also introduced him to use some useful features like the reporting of expires and the transaction data. Okay, next slide, please. Other uses or the e-learning platform is Mari. She's a finance cashier with MSP. So she's one of the first users of the model e-learning platform, and this is her feedback. She said that the course was very easy to use, everything was clear, and it was simple to follow. And she would recommend those working with medical supplies to take the course. So I think her point, that her response or her feedback came from doing the introduction to medical supplies. All right, next please. We also have another feedback. Sorry, there was actually a slide there, but I'd read from my slide. There's Data Revolution who said that whose feedback was, if you will be using MDM, or who took the MDM course on the new e-learning platform, his feedback was that if you will be using MDM as part of your job as a support worker, MDM training will come in handy regardless of whether you are in IT or not. Next, please. We also have a feedback from one of our pharmacists working with Warren Hospital, Pamela. Her feedback: participants can access it anywhere in the comfort of their homes or office. The courses are well structured and easy to follow through. Okay, with the responses or the feedback from those that were able to do or have access to the e-learning platform, we have our challenges next. Slide, please. I'm sorry. So, in summary, previous slide. So, in summary, the e-learning platform is user-friendly, it's clear and easy to follow, and it does have impact wherever your field is or whatever you're working. Next, please. So, there are limitations in the context of Papua New Guinea, and the two main reasons is the types of trainings, and the other one is the accessibility of electronic devices. Now, with types of trainings, we do have, or we do come across elderly um, users of RAM supply. So these are mostly clinicians who work in rural areas. So we have to somehow make it presentable for them to learn how to use M supply. So, like I previously introduced, I had to take the honors to learn myself, or teach myself, so I could bring that out to them. Next slide, please. So, what we've adapted, or I've taken from, or taken from the e-learning platform. I've put it into hands-on practical sessions, and also we've adapted some of it to include in our pre and post and supply knowledge evaluation. So I will talk a bit more on the pre and post and supply knowledge evaluation after this. Next slide. So with the hands-on practical sessions, you can see here. Next slide. Um, we engage with the users. Next slide. Where we incorporate their manual processes or incorporate M-Supply used into the normal or the manual processes. Next, please. All right, so our hands-on practical sessions, we've tailored it to focus around the four basic functions of inventory management. So this was taken on board because we are mindful not to overwhelm the trainees. So these are not specialized in these are not officers who are specialized in supply management, but the clinicians. So we focused on only on these four areas, and then we deliver the training. Next, please. So on stock take, next please. So this is one of the practical sessions that we had with the users on site, OM supply users. We tried to do the stock take procedure with them, and as well we did a theory, and then we moved on to doing the practical, and then moving back and forth. Next. All right, so that's the adapting some of the e-learning key points into the practical sessions that we have. All right, now with that e-learning, we've also created some, or just to see the impact of the training that we delivered to the sites. So we've come up with pre and post M-Supply knowledge evaluation. So these are more true statements, but then the responses will be in like a skills where you say, come back with, you strongly believe this statement or not, and then you strongly disagree. All right. So as you can see here, there was one that we've adapted from the e-learning, is that and multiple customer invoices can be generated from the same acquisition. So this was before the training was delivered, and then there's the side-by-side post-evaluation of that same question after delivering the training. So you can see a variation there that previously there was neutral response, and then we received some strong feedback or agreement to that statement. Right, next. Another example is with the statement, the transaction with the status confirmed or CN can still be edited, and the quantity of stocks have also been updated according to the transaction type. So you can see the variation or the difference in the responses. So with the post evaluation, we only come up with two responses where they either agreed or strongly agreed. Right, next, please. That's all. Thank you.
Fantastic. Thank you so much, Geraldine and Louisa. Really fantastic to see how far the M-Supply learning platform has come over the years, and to see it really implemented out in the field in Papua New Guinea and making a real difference over there. So that takes us to the end of this webinar. I believe the questions in the chat have all been answered. So I will conclude now just with a plug, I guess, for our next webinar, which is on the 10th of July, looking at a massive release of a whole bunch of new features and modules in Te Manu, so our electronic medical record that's used across several countries in the region. A few of the main features are listed there, but there's also more. So please come along to that. And please feel free to reach out to us as well if you have any other ideas of what you'd like to see covered in this Pacific Digital Health webinar series. So thank you so much, everyone, and we will see you next time. Have a great rest of the day.